Welcome to the Salience Podcast, where we identify what stands out from all the noise.
Today on the Salience Podcast, we explore health and the relationships between personal agency and systems. I'll declare up front that I have a strong personal belief that prevention is better than cure. As a society, we underinvest in preventative health in favour of big pharma and a medical model that focuses too much on remedies. Many people would rather take a pill than make the effort to eat healthy whole food and move well. In the memes and commentary on social media, there's also pervasive rejection of personal accountability, choice and agency, to a belief that health and behaviour is an emergent property of society, the system, and the places we work. To be clear, my personal bias is right in the middle. Enabling personal agency is essential, and I'm a strong proponent of systemic health interventions. If we are looking at preventative health programs, for example, I think we need to work at all levels: individuals, families, teams, organisations, communities, and national initiatives, and in fact, international initiatives. The problem with pretty much everything I've just said is it's riddled with opinion and personal experiences and light on with scientific evidence. And that's where today's guest comes in. We're joined by Dr. Anita Shankar from Johns Hopkins, Department of International Health within the Bloomberg School of Public Health. Anita researches and develops behavioural interventions to foster personal agency and leadership in vulnerable populations. Her research has spanned a range of health and development issues, including women's empowerment, gender-based violence, maternal and child health, HIV/AIDS, nutrition, community mobilisation, and human resource capacity building. A current focus of her work is on developing interventions to strengthen personal agency as a mechanism of catalysing equality and equity for women and other disadvantaged populations. In the past 25 years of research and field experience in international health, she spent nearly 14 of those years living and working in Nepal, Papua New Guinea, and Indonesia, and also has research studies in India, Kenya, and Rwanda. So today, I have an opportunity to cover broad issues, from the evidence base for behaviour interventions to assist disadvantaged populations, through to what we can learn in affluent Western society from Anita's work in countries like Nepal and Indonesia. Welcome, Anita.
Hello. Nice to be here with you.
Okay, before we dive into your most recent work, how did you end up researching health and behaviour interventions? Were there any inspirational moments from your early days before becoming a researcher? What kind of led to where you are?
Yeah, well, I have a very kind of circuitous route here. I did my undergraduate in microbiology and decided I didn't want to become a physician. I wanted to work in biotechnology to be able to create a food that could feed the world, because at that time, in the early 80s, that was the kind of the solution. And then I realized actually I didn't really like to be a microbiologist, and I wasn't particularly good at it. So I did my master's in biology and learned a little bit about statistics and discovered epidemiology. And I was like, oh, this is quite exciting and very interesting to look at populations at scale. And at the same time, I was searching for a way to contribute through public health in maybe a slightly a different perspective than the traditional biomedicine. I was born in India, but came here in the early 60s with my mom. My dad was here doing his PhD and was raised here. But we have a lot of family in India, and we're very connected. In fact, my father was the first person in his family to have left the village to come here to the United States. So I understood quite well the challenges of living in very resource-poor settings, and decided what I wanted to do for my doctoral work is to do medical anthropology, actually, so that I could serve as kind of that conduit, that liaison between the biomedical space in the local villages where poor health was being expressed. So I've actually been doing development work for about 35 years now. We'd been living and working overseas for many years. We also raised a family and came back to the United States in 2010. Now, during that time, I had done work on nutritional health, vitamin A deficiency. I worked in HIV/AIDS and pregnancy. I even worked in clean cooking and household air pollution as qualitative researcher. When we came back to the United States, one of the things that I recognized was that while we were making people a little bit healthier through our programs, they were still living in poverty. And the actual large-scale impacts of our health programs were very small compared to the need and the challenges faced in these populations. So I was like, we have got to be able to do better than what we're doing. There's got to be a different way to do not only the research, but also develop programs. And I would recall going into these villages, talking to women about feeding their child green leafy vegetables, ensuring that they went through their requisite 4 visits to the prenatal care when they were pregnant, and recognizing that the women would smile and shake their head. And I knew that they couldn't leave the house because they didn't have permission or they didn't have money. So there needed to be something that could be done that could meet people where they were, that would help understand kind of that disconnect between what an individual wanted to do and what they felt they could do. And it wasn't just the women. It was the men, it was the children, it was the youth, it was the elderly folks. And so I thought, we need to be doing empowerment trainings of some kind. We need to engage people, help them understand how their mind works, how they make decisions. But what could we do how can we engage them on populations that are often illiterate and, very resource poor? What kind of intervention would we need? And I figured because people had been talking about empowerment and agency and resilience for decades, that there must be a whole slew of interventions that had already been designed and tested. And it was a significant pivot from the research that I had done for 25 years. And then when I looked through the literature and looked at various different program activities, I realized there wasn't really much there. So I started testing out a few different things in the populations that I was already working with. So sex workers in India and Kenya for the rural and urban poor, mostly women's groups, but I also worked with men as well. And what really shocked me is in these pilot testings that we were doing around this intervention, where we just brought people together, we did some simple exercises over the course of 2 to 4 days where they got to understand who they were, how they, their tree of life, basically, how they came to where they are now, the experiences that they've had, some basic psychological tools like understanding the relationship between our thoughts, our emotions, and our actions, and just engaging them in these kinds of conversations where each individual had an opportunity to explore their own life within the context of that group. And what I didn't realize is how transformative those kinds of engagements could be. And then and I had to convince myself, because I had never done any type of an intervention like this. And I was much more used to giving them technical knowledge, giving them skills, providing them with a vitamin A capsule for their child, etc. But to talk about some people's life and what's important and the role of sociocultural norms and like creating limiting beliefs, like I didn't believe that this would actually make a difference, because to me, it seemed like these are really complex ideas. They're abstract. Nobody's going to understand it. But to my surprise, actually, not only did people understand it, but then they were able to take this knowledge and they were able to take action toward the things that they wanted in their life, which often was start a new business, build relationships, improve their relationships in their family, be more proactive. They were more pro-social. And so I spent the last 15 years, actually, since 2010, actually, when you mentioned that, I can't remember whether you mentioned it here or something that I heard on your website. But I was like, I've got to figure out what I wanted to do that I thought was going to really make a difference. And that took a lot of investigation. And I had to convince myself with the data that actually something was changing. But the kinds of changes we saw were phenomenal. I had never participated in a public health program that had led to these kinds of changes. They weren't really incremental. For me, they were transformative. So it was a really long answer to your question.
No, that was a fantastic lead. And you've got to really, what I suspect is some of the most exciting parts of today's conversation. You've seen, you said transformational changes. Can you tell us what are some of the sorts of changes that you saw? You said, start a new business, relationships, family, they become more proactive. Can you tell us a little bit more about some of the impacts that you've seen from these really quite simple exercises you described, getting connected to your thoughts, your emotions and actions, ways of thinking and decision making? What was the impact of that, either at individuals, families or communities?
Yeah. I can tell you the thing that that really shifted it for me, and I don't know if I'm having internet challenges or not, but let me know if you can't hear me. We were working with a group of brothel-based sex workers in Pune in India, and this was in collaboration with Saheli, which is a local sex worker collective. And we had modified this training to allow for these women to come. Now, these women were sold oftentimes by their families when they were very young to these brothels, and the families would often come and take a portion of their women's earnings and things like that. So we did this, and we followed about 200 women, and a couple of things really stood out to me. The training it went over a couple of weeks' time, and we talked about issues like sexuality and issues that were central to their women's lives. But we weren't sure actually if they would be able to comprehend much of what it was. But we followed them for about a year, and there was a tremendous increase in savings. Health seeking, about 45% of them had HIV and they were taking their meds. There was greater adherence to their medications. They were getting tested for TB, diabetes. They're visiting the gynecologist on a regular basis. But what I didn't expect to see over the course of that 12 months was 30% of those women were able to successfully pay off their debt to the brothel owner and leave sex work on their own, either with a partner or going back to their village. And that really shocked me because it didn't require being rescued. These women were so creative in coming up with ways to overcome the challenges that they were facing. This one woman who was sold by her, I'll just tell you real quickly this story about this woman. She was sold by her dad when she was 17, and she was 23 at the time. And she had, during the training, said, I have to service 8 to 10 men a day in order to be able to simply survive because my father comes and takes a portion of my funds. And then I have this loan that I took, etc. And so she went up to the brothel owner and she said, listen, can you please, I disown my father and I don't want to have to give him funds on a regular basis, on a monthly basis. And the brothel owner was kind of chuckled a bit and kind of left that. And so she changed the way she approached the brothel owner again. She went up again and said, "So how did you get into this business?" And the brothel owner said, "Well, I was sold by my dad many, many years ago, and then I kind of went up the ranks, etc." And she said, "So you know how I feel. You know the struggle that I have. I'd like to ask you again if you'd be willing to help me." And this kind of changed something in that relationship. And so the father came at the end of the month and asked the girl, "Please give me my money." And she says, "I disown you. And, I have no relationship with you. I have no obligation to you anymore. So please go away. I'm not going to give you the money." And the father got quite upset and said, "This is ridiculous." Went to the brothel owner and said, "Please give me my money." And she's like, "You heard the girl. She disowns you. She has no responsibility to do anything for you." And, that was it. He didn't have any choice. He had to leave. So it took this girl 8 months after that time to be able to fully pay off her debt. And she left with a partner that she had strong relationships with and left on her own and started her own business, actually. So each of the individuals who created these changes, they found a way within the context that they lived. Nobody told them what to do. They figured it out themselves. And not everybody is ready to take those chances. But when you have, individuals from your peers start making these kinds of changes, other women like, "Well, they did it. Maybe I can do it. How can I do it?" And in fact, over the course of a couple of years, the brothel owners came and said, "I don't know what you're doing with these women, but we want to have this training also." Yeah. So I was like, okay, there's something to it. And we published a couple of different papers and so on and so forth. But people were like, nah, this doesn't make sense. What do you mean? What disease are you working on? What do you mean by psychosocial interventions? What's the evidence base for this, etc.? So it took us a long time to do the pilot studies. Again, we had to be convinced. I had to be convinced. We had to do the randomized controlled trials, and then we had to continue to deploy it in different settings to see, okay, well, what kind of impacts can we expect to see? So we've done it with entrepreneurs, we've done it in refugee settings, and in 2020, actually, we got some funding to be able to launch the Self-Empowerment and Equity for Change Initiative, or Sea Change, and I'm the executive director of that initiative.
Wow, that's incredibly impressive and impactful. And it very much flies against the I'm going to call it the social media meme. You see a lot of people talking about system change. It's got to come from the system. Behavior is a product of the system. And, it's an emergent property and people are really disempowered. Even the term social determinants of health.
Health, yeah.
Is a very strongly systemic causal mechanism. And here you're saying, look, we can go in with individuals, we can train individuals how to experience the world differently, how to think differently, how to negotiate differently. And it can change systems. It can change their lives, their families, and it can reverse engineer the systems.
It can. And you need both. Exactly what you said in your introduction. You can't have just one because there's always very strong hindrances. And you need to have people who create new systems, who have the ability to catalyze that kind of internal change because they know the system. And so it's just within the realm of public health. What would that look like? And I think people are a little bit they don't know how exactly they think about it, because it's not a mental health intervention, right? We're working with normal people working in abnormal circumstances, but the processes are the same, in terms of how you build resilience. And I think, in addition to very oppressive either sociocultural norms or systems that exist with social media and digital access, there is a removal of agency, because we don't know what the right step is until we look at our TikTok that says, oh, do this.
You've just hit on something really important, and you used the word catalyst, and I just scribbled in my notes, catalyst. How do we accentuate everything you're talking about? How do we go and make those interventions generative and societal and systemic? And then you put a dampener on that by saying, well, actually, social media has almost gone the other way. It's disempowering people. It's reducing that sense of agency, that sense of personal accountability, personal responsibility, the choices I can make. What can we do to catalyze what you're talking about? I know this is like the billion-dollar question, but what can we do to catalyze? How can we get those changes to be generative?
Yeah, that's a great question, and I think there is not one single way. But what we have to do is continue to build both the evidence and the processes that can help create pro-agentic, pro-social engagements and behaviors, building upon who we are as humans. So recognizing our basic human needs. If we learned anything during the COVID time, we recognize the importance of belonging and engagement and interpersonal relations as being really critical, we could to our health in general and our mental health. And mental health doesn't necessarily have to be the diagnosis of depression or anxiety. We can begin changing the narrative about how we talk about our human potential in ways that are more inspiring and more reachable, actually. But we have to create redundancy in the systems to promote this way of thinking and doing. So promoting habits of thought and action that increase the likelihood that people will practice engagement of their basic humanity, either by creating things, innovating things, being able to try new things, engaging with other people, really have that practice and reinforce systems and structures that have existed that but we've kind of set aside because we're so busy working on our phones. Sorry, there was a phone call that came in. Okay, yes, yeah. So I think it's possible, and I think at least what we are trying to do at Sea Change is help build a movement, a momentum behind evidence-based processes. We mainly focus on resource-poor populations. That's kind of where my background is, but the basic principles are applicable to everyone. In fact, we do a lot of work with women in male-dominated sectors globally, like with the National Renewable Energy Laboratory. So within technology and in agriculture, in energy. So really just to help anyone, male, female, or whatever. I think one of the challenges has been because oftentimes there's this focus on vulnerable populations. Let's focus on the women or disabled individuals. What we would like to promote is we all can benefit from these type of exercises and processes. And it doesn't have to be, let's just focus on the women, or let's talk about equality. I think everyone can become a better version of themselves if they recognize that these tools are available and they practice them. And I don't know exactly what it's going to take, but I am hopeful. I am hopeful because actually, globally, we're better off as humans than we have ever been before. And we have a lot of challenges, and I suspect that will continue. But what an opportunity to really build that resilience, muscle, and strength. I mean, the kind of people that you have worked, the kind of activities that you have done, you know what resilience looks like. And yes, sure, some people are kind of born with some of these qualities, but most of us learn it along the way. And we've required that support from other people who are like, yeah, let's try this. Let's work together around it.
I couldn't agree more, particularly around, there's so much you said there. Really important point. Some people are born with resilience. Most of us get to develop it through life, and it can be taught.
Yes, it can be.
What a great example you gave of teaching the young woman in the brothel who's in a really, horrible environment, horrible situation. She's indentured. She's been sold by her father, and she's in a trap that she can't get out of. And she really learned some resilience skills, and she learned some negotiation skills, and she learned how to create empathy in the brothel owner for her, which just changed her life. And these are skills that can be taught. And you said over a matter of a couple of weeks. This is not a life. You don't need to study this for life. These are some fundamental ways of being and communicating and relating. So I absolutely agree with you. And you said something. You said several things that were incredibly important in there. Now, one of them was about a momentum, and you said, getting behind evidence-based approaches. And I think this is the key, right? If we can have enough evidence-based, enough quality research, and we pay attention to what the research says, then it will help us evolve the sorts of programs and interventions that we do. The stuff that doesn't work, that's usually backed by big money because it's profitable, will eventually fade in favor of much more cost-effective methodologies, just as you've described. And I just want to go there for a moment about the types of studies you're doing. You talked about randomized controlled trials, working across different sectors and replicating pilot studies, moving from women indentured in brothels through to entrepreneurs and into refugee settings and all sorts of different things. Tell me a little bit more about the science. What is it that what are you doing at the moment that's giving you great insight, a great value?
Yeah, it's a good question. There's a lot happening both in economics and social psychology and sociology that lets us understand what happens both at the individual level, family level, and also the community level on how we process information and use it. A lot of the research trials that we do, they're almost always mixed methods. So we use quantitative and qualitative methods. We use a lot of randomized controlled trials because that allows us to feel a bit more confident in terms of more the causal impacts of an intervention that has been tested. A lot of what we're looking at is not only what kind of impacts can we see, whether it be increasing income, improving intra-household task sharing, reducing gender-based violence, but also we're looking at what are the things that get in the way, for example, for an individual to start behaving in ways that may be counter to the existing sociocultural norms, in a way that can generate new ways of thinking and being within that community. that are aligned with the values of that community, but currently are being hampered by certain norms. So we're kind of looking at ways to be able to promote pro-agentic behaviors in certain populations. Again, almost all the populations we work with are resource poor. And what are the characteristics of those individuals who are able to break through that to greater success and resilience? And how do we build upon our knowledge of basic human needs, about our need for social belonging, our need for trust, etc., to reinforce that learning and interpersonal relations and communications, to build resilient units like family units, community units. And there's a lot that needs to still be done. And there is growing evidence of the impacts of these agency-focused interventions. There's some work that's being done by Greg Walton at Stanford around what they, and Catherine Thomas actually at the University of Michigan, talking about culturally wise interventions that recognize that have a strong theoretical basis in psychological processes, understanding the role of sociocultural norms, and then developing really short, small processes for people to experience, and then kind of follow what happens within that context. Show a short video about an event, then have a community discussion. What did you just see? What do you think worked? What didn't work, etc. And so there's have these small focused interventions to lead to a specific outcome, like, for example, encouraging women to get their prenatal care visits, and also training activities, which are happening anyway, but are usually not as effective as they could be. And just finding ways to build local capacity around these ideas, because that's where that innovation and creativity occurs. Because if you can train individuals in the village or in the community around these concepts, then they can begin translating these in such a way to be powerful, like, magnets or, ways forward in terms of communicating these ideas that are sticky that people will use. Even when we did the work in the humanitarian and Congolese refugee camp in Rwanda, we trained men and women from the camp. And that was really very powerful. And then because we trained women and men, we were able to have them get trained and then have that communication. Well, what did you learn? So it's not just the women saying, "Oh man, you're drinking all day, et cetera," but it's the men saying, "I've lost everything. At least you have the family. And you're telling me you're married to the UNHCR, who's giving you food and firewood. Then who am I and what use am I to anyone?" And all of a sudden the women are like, "Oh, that's terrible. You have lost more. I never recognized it." You know what I'm saying? So just those kinds of conversations. It was so interesting because we were doing the training. Someone's like, "You don't know what it's like to be a refugee. You can't just tell us that, that there's a different way to see the world and it could be better. We've lost everything. We've lost our animals. We've lost our jobs. We've lost our homes." And I'm like, absolutely, I have no idea what it's like to be in your shoes. But let me ask you this. What do you think the possibility is that things are going to change with that mindset that you have now, that you don't have hope? And what would happen if you just shifted that a bit and say, "You know what, maybe there's something I haven't thought about that I could try"? It completely changes how you see your world. And that's really all we're trying to say. We're not saying do X, Y, Z. But use the power of your mind to be able to find out, where the light is, where the hope is, because you can then pursue different ways to go forward. And that isn't anything that I could or anyone else who isn't in your shoes could come up with.
You've touched on a number of really, really important topics there, particularly around the difference between teaching the fundamentals of thinking and advice giving.
Oh, yeah.
Advice giving is invariably not fit for context. We can't possibly know the intricacies of the context that somebody's in. However, if we teach the thinking processes and allow them to use those to solve their own problems, they're going to find incredible ways out. So I really like that. And you also said something else that's incredibly important. You said that you pay attention to the characteristics of individuals who are able to break through. And this is a fantastic approach. This really underpinned the book that we wrote on resilience. We didn't go to the academic literature. We went to hundreds of resilient individuals from frontline agencies, and we asked them, when you're performing at your best, that's like what? And then we look for patterns. And the recurring patterns time and time again, we identified probably 85% of the material that we trained from the room in a group of people, and we could refine it. And then the training was less about us telling and much more about just teasing out what was already in the room. 15% maybe might have come from our experiences elsewhere, but most of it would be in a room of a dozen people. And that's what I like about this idea of these characteristics of individuals. And you talked about training everyone, men and women, even in refugee or gender-based violence situations. This is a highly controversial topic, and it's very emotional, of course, because we have to get away from what might be fair. Because if it was fair, you'd just change the system and you'd get men to behave differently, to the intervention, which might actually have to come from women in this case. But I want to just flip that for a moment and think about power and men and gender-based violence and those characteristics of individuals. If there's one reflective piece or something that you've discovered that shifted from those men that were part of those systems of power and violence who switched, became kinder, no longer using violence, what would it be? What have you seen that's a characteristic of that shift? Or is it something they've learned or something you've taught or something you've seen? What is it in there that's worked?
I don't know whether there was I don't know if there was just one thing. There are a few things that kind of stand out to me. One is that often these individuals who express violence, it comes from a root of depression and despair in their own lives. And having and being treated with some kindness from the women around them or others around them, actually, or what was a bit interesting for me, because they felt heard, and they also had been holding a lot of their frustration and anger inside for so long and never had a way to express it. And so having safe spaces with other men that was an important thing. The other thing, when we talk about intimate partners, was a recognition that actually there were shared goals that they had for themselves and their families, that they never really looked at or explored together. And so that was important. And we get into like automatic ways of thinking and acting that make it harder for us to get to the things that are most important for us. I mean, it was quite interesting. We were working it was in Mozambique. It was with part of a utility company where we wanted people to be exposed to some of these personal agency tools both women and men. And I remember one of the managers said, "Look, I'm going to bring some of my guys in. They're not going to talk about all this stuff. They're not going to be emotional or anything like that. So you can come in, we can do these exercises and see what happens." And lo and behold, there was a couple of the young men who actually broke down because they said, I want to be able to provide for my family, and this is important to me because I love them so much, and I'm remembering why I'm here doing this work, and I have, in my blindness, treated my son differently than my daughters, and I'm holding them back. I want them both to be able to thrive. And this actually surprised the manager. But, again, these are just anecdotes of kind of these things that we see. And of course, we understand that gender-based violence is quite complicated, but our approach to having these conversations, because I do have to say that we're seeing a little bit more of kind of this backlash against, look, why are you blaming men for everything? And so, I've got invited to this gender program or this exercise. What, did I do something wrong? Did I treat somebody badly, etc.? And so the way we try to talk about this is just for everyone, look, these are processes that help you be a better version of yourself, whoever you are, whatever position you have. Oh, and guess what? A lot of the ways we think about ourselves are as a result of the sociocultural norms that we have grown up with. You may not even be thinking about, what do you think when a woman comes in the room for a job, or, a man is behaving in a certain way, or how should a man act? How should a woman act, etc. And that self-reflection made it a lot easier to understand, I see I've created stereotypes and biases that end up being expressed with the individuals that I work with. And maybe I don't necessarily have to be doing this.
Yeah, incredible. There were several points in there that are highly relevant. There's the expression of frustration and anger, the safe spaces. There's an underlying depression, despair. There's the cultural elements like expectations of others. And then there's one thing that I really liked that stood out, which is when you take an inclusive approach for everybody, you identified shared goals. And I really like that. And I hadn't thought of that or recognized that before. Just thinking about what you've learnt in vulnerable populations in places like Mozambique, Nepal, Indonesia. If we could learn something for more affluent Western society, the US, Australia, Europe, what would it be? What could we learn? What could we take from that could transform our societies? If there was one thing, what would it be?
Yeah, it's interesting because I think there is the notion that when you are living in these resource-poor settings, the roles of sociocultural norms really are very strong influences. And when we are, living in these more affluent places, they're less likely to convince us to behave a certain way. And I don't think that's true. I think we are shaped and act and think in ways that we believe are the ways that we should to fit in whatever society we're in. And they often limit us in the way we see ourselves, in the way we interact with others. And I think that's been somewhat neglected in the conversation around agency because we think it's this individual thing and we have autonomy and the ability to do whatever we want. That isn't really true. We have families and relatives and society and structures that we have to navigate that are influencing how we see ourselves in the world. And so that's one point. The other point is don't get too excited about all this digital technology and information because it is critical that we reinforce our humanity every day in a range of different ways. And we have so many tools available to us: mindfulness, meditation, ways of engaging, social structures, exercise, good diet, all of these things. We can be greater agents for ourselves. And once we get kind of addicted to the, oh, guess what? I have more power than I thought. One, we take more action, but also our lives become much more exciting and interesting because we're much more likely to make new friends, take new risks, create new things. I don't know if that's helpful, but anyway.
Yeah, absolutely. I like that closing thought there, that I have more power than I thought, and it can make life more exciting and interesting. And I think if I was to summarize our conversation, it's about the fundamentals of resilience and the learning that we can get. It can be taught. We can discover that we've got more power, more potential to create the lives that we want. We can use evidence-based methods to support these sorts of interventions, particularly in disadvantaged populations, using things like mixed methods, RCTs. We can look at the impact for individuals, for families, for communities. And there's something else, the final piece I'm going to take away, and that's very much your approach about working with individuals to develop agency, working with everyone. And you've just said that really this is universal. It doesn't matter if you're in Rwanda or if you're in New York. These are the fundamentals, and we're still we're entangled with sociocultural systems that can influence our thinking. And if I'm going to leave with one caution, which I've really endorsed, and I want to end with this message, which is be very careful of social media and digital, and go back to the fundamentals of who you are and how you make decisions and the relationships you have. I think that's a great leaving comment. And I've got one more question, which is we talked about your early days. You've come from India, you're into the States, and you've lived in Indonesia, and you've come into this pathway from being a microbiologist through to now this agency catalyst and researcher. What are your future aspirations, either work or elsewhere in your life? What's next?
Well, I want to find more friends who want to keep pushing these same ideas and incorporate these in how we do development, in how we educate our children, and how we work together. Yeah. So, it's interesting. So this is an important season in my life, I guess. My kids are grown. I'm 62. I've got time available. So my hope is to continue to build as much evidence base as I can, collaborate with others in the field, economists, psychologists, sociologists, anthropologists, development folks, funders, stakeholders, whoever wants to talk to us, and continue to develop, operationalize actually different ways that we can become better versions of ourselves and better humans. And I think there's so much out there. I think we can kind of sometimes get stuck in the hype around it, or, but I think there's real science behind it as well. And so I'd like to see it incorporated in ways that are adaptable in different settings and actually create change. That's what I like to say.
Very exciting. Love to collaborate on this. And, what a great concluding future aspiration. More friends to collaborate with, and it's about science and adaptability, collaborating with diverse fields. And I like this idea of the, building in the economics, which is, where do we get the best value for these sorts of interventions? And I think a lot of what we're currently investing in as a society for health, for global health, should go by the wayside in favour of things that are much more cost effective and actually a lot simpler.
I think so too. Because otherwise we're making people like a little bit healthier in poverty, right? I mean, the economics are very important. So absolutely, I totally agree.
Fantastic. Thank you for today's conversation.
Yeah, it was a real pleasure. It was a real pleasure. I hope to have an opportunity to be able to engage with you more, learn more about your program activities, and really great to be connected with you.
Thanks again.
We hope you enjoyed this episode of the Salience Podcast. Please leave us a review and subscribe wherever you get your podcasts. You can also subscribe to the Frontline Mind newsletter by visiting our website at frontlinemind.com. Have you got a topic you would like some more salience on? Send us a message on LinkedIn or email team@frontlinemind.com.